Good morning. Welcome and thank you for joining us for our Northern Light Health Business to Business Zoom conference. Today, our theme is the pandemic's unexpected impact on mental health and substance use. We'll start off with a COVID-19 update. We'll then shift to look at people with longer-term mental health and neurological symptoms, where 1 in 3 people have these types of symptoms after COVID. The pandemic has certainly taken its toll, including an increased recognition and diagnosis of anxiety and mood disorders. We'll take a deep dive into these conditions. Substance use has also increased, and we'll be looking at alcohol use as the dominant substance plaguing Maine. I'm Dr. Ed Gilkey, Senior Physician Executive at Northern Light Beacon Health. I'll be your moderator for the next hour. Our panelists today are Dr. Jim Jarvis, Director of Clinical Education and Incident Command Section Chief at Northern Light Health, Yamaya St. Clair, Employee Assistance Program at Northern Light Workforce, Jacqueline Sear, Director of Substance Use Services at Northern Light Acadia Hospital. Before we get started, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply in your specific situation and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and/or your customers and clients will not contract or spread the coronavirus. In regard to employment, every situation is unique and must be reviewed on a case-by-case basis to ensure compliance with the law. The information presented should not be taken as legal advice, and you will need to retain your own counsel to review specific questions regarding employment situations and/or accommodations in your organization. A reminder, this hour is for you. If at any time you have a question for one of our panelists, please use the chat function. I'll keep track of your questions and have our speakers respond. Also, I hope each of you will take a few minutes immediately following this hour to answer our quick 5-question survey. Your input directly affects our topics and helps guide our future conferences. Our panelists will share some key information first, then we will have questions and answers. First up, I'll share some COVID-19 updates. Vaccinate. This is the punchline for our update section. Dr. Shah commented on May 14th, getting vaccinated is the best way to protect yourself and your community from COVID-19. Governor Mills echoed this by saying, please don't wait, get your shot now, vaccinate. So where do we stand with COVID-19? One way of looking at the illness burden is by looking at the trend of occupied ICU beds with people who have COVID-19. Let's focus on the orange bars over time. Looking at the United States on the left, we can see the orange bars are biggest during January, and this coincided with the surge that we experienced. Looking at Maine on the right, we see an increased size of the orange bars in January and also today. The people who were hospitalized last year across the US had an average age in the mid-60s. Now the average age of those hospitalized is in the low 40s. The new variants are transmitting easier between people and making people sicker. Overwhelmingly, the people who are hospitalized are unvaccinated. Since the majority of unvaccinated people are in the young age groups, we're seeing young people hospitalized and very sick. Let's now take a look at new cases of COVID-19 in Maine. This graphic represents the average new daily cases over the past week as of May 17th. So any color represents new cases occurring. The darkest colors are the worst situation, Red represents very active spreading of the virus variants, and this is not good. Next slide. On this slide are some factoids that will be useful to consider. The Pfizer vaccine is available for people ages 12 and up. Moderna and J&J vaccines are available for ages 18 and up. Approximately 50% of Maine residents are fully vaccinated. On this slide is the website and the phone number to access a vaccine. Coming on May 24th in Maine, fully vaccinated people do not need to wear facial coverings except in healthcare settings. In outdoor settings, capacity limits and physical distancing will be lifted. In many indoor settings, capacity limits will be lifted and physical distancing requirements will as well, except where people will be eating or drinking, and therefore unvaccinated people will be removing their facial coverings. Some examples are on the slide. The website is at the bottom of the slide and should be reviewed for updates. Let's really process through all these moving parts and figure out the bottom line. So the global strategy to end this pandemic is to achieve herd immunity. This is also known as community immunity. To achieve this, 70 to 85% of all people need to be vaccinated. To gain control of this worldwide infection, to keep people from dying due to the virus, and to get back to an acceptable way of life, the bottom line is vaccinate. On that note, we now turn to Dr. Jarvis, who has devoted much of the last 6 months to helping people in Maine get vaccinated. Thank you, Dr. Jarvis, for all you do. He will look at mental health and neurological symptoms related to long COVID. Jim?
Thanks, Ed, and thank you for those kind words. Definitely a team effort, and so proud of the fact that Maine continues to lead the way in vaccination efforts, but we still have a long way to go. And one of the reasons for that is because we are now seeing that there are more bad outcomes related to COVID than what we talked about initially. So initially, if you remember, we talked about that, people who got the majority of people who got sick had some mild symptoms, they recovered, and then they went on. And I think that's what's led to some people to be hesitant about getting their vaccines is, oh, well, I'm a healthy individual, so if I get COVID, I'll just get better and I won't be one of those statistics that Ed just mentioned. However, what we're finding is those same individuals suffer from some long-term consequences that they may not have recognized and may continue not to recognize. We know now that up to 30%, and actually the number is probably a little bit higher than that, of individuals who have had symptomatic COVID report some form of neurologic deficit. And these can include things like memory loss, the phenomena known as brain fog, which is really a phenomena where you have difficulty concentrating or thinking. Some people experience seizures, some people have had strokes, and then others have had a condition called neuropathy, where they have a prolonged numbness or tingling or a loss of sensation in their hands and feet. And so those are very concerning. If we just look at that brain fog one and we start talking about younger individuals, particularly those who are in school aged or in college, do we want them really to return to school after just, quote, a mild infection with COVID-19? And yet not be able to participate in their classroom and homework studies, similar to children who have had concussions out on the sports field. And so that's something to be concerned about. So next slide, please. So what are the risks? At this time, we don't seem to know who it is that's at risk for having these neurologic and mental health conditions associated with COVID. It really seems to be spread across all populations. We do expect that those who have had prior brain injuries are more susceptible, so such as those who have had traumatic brain injury, such as because they were in an accident or because of head trauma due to sports related, people who have had strokes, or people who have been critically ill, particularly those who have needed a ventilator. But as I said, this seems to be spread across all populations and including people who only have mild disease when they are infected with COVID-19. Next slide, please. So how long will these last? Well, aside from permanent conditions like having post-stroke brain damage, a third of people fully recover within a few months, but a third have lingering effects that eventually improved, but a third continue to have persistent symptoms. And remember, we now have people who have had COVID over a year ago and many of them continue to suffer with these long-term neurologic effects. And I think that should be another message for us, particularly for those people who are hesitant about vaccination, that COVID is not just a mild disease. This virus is finding a way to affect us in ways we have never seen before. And these are the long-term consequences of even just, quote, that mild disease. And the best way to prevent that is through vaccination. So now I'll turn it back to you, Ed.
Well, thanks, Jim. Next is Yamaya St. Clair, who will talk about anxiety and mood disorders. Yamaya?
Thank you so much. Thanks for having me today to talk about this really important topic. Although 1 in 5 Americans have been experiencing mental health conditions for decades, stigma has shamed too many into silence and prevented them from seeking help. 2021 can be the year that stigma ends. The COVID-19 pandemic is shining a spotlight on the prevalence of anxiety, depression, and substance use, igniting a national conversation around mental illness and substance use disorders. Before looking at the rising prevalence of mental illness during the pandemic, I want to first look at these general statistics. 46% of Americans will meet the criteria for a diagnosable mental health condition at some point in their lifetime, and half of those people will develop conditions by the age of 14. Unfortunately, less than half of people with mental illnesses receive treatment. There are, of course, a lot of reasons for this, including a shortage of accessible treatment options in many places, but one of the biggest reasons is stigma. So stigma is when someone, or even yourself, views a person in a negative way just because they have a mental health condition or substance use disorder. According to the National Alliance on Mental Illness, NAMI, some people describe stigma as a feeling of shame or judgment from someone else. Stigma can even come from that internal place, confusing feeling bad with being bad. Mental illness and substance use disorders are not the result of personal weakness, lack of character, or poor upbringing, as some stereotypes lead us to believe. They're not anyone's fault any more than heart disease or diabetes is a person's fault. According to the Surgeon General's report, mental disorders are health conditions that are characterized by alterations in thinking, mood, or behavior, or some condition thereof, associated with distress and/or impaired functioning. Mental illnesses and addictions are not conditions people choose to have or not to have. So dispelling these false ideas about these conditions really helps to reject those stigmatizing stereotypes. The COVID-19 pandemic and the resulting economic problems have negatively affected many people's mental health and created new barriers for people already suffering from mental illness and substance use disorders. During the pandemic, concerns about mental health and substance use have really grown, including about concerns about suicidal ideation. In January 2021, 41% of adults reported symptoms of anxiety and/or depressive disorder. That share has been largely stable since spring of 2020. A Kaiser Family Foundation health tracking poll from July 2020 found that many adults are reporting specific negative impacts on their mental health and well-being, such as difficulty sleeping or eating, increase in alcohol consumption or substance use, which I know Jacqueline will be speaking about after this, and worsening chronic conditions due to worry and stress over the coronavirus. There's a variety of ways the pandemic has likely affected mental health, particularly with widespread social isolation resulting from the necessary safety measures. A broad body of research links social isolation and loneliness to both poor mental and physical health. So let's dig into this data a little bit more. Young adults, we know, have experienced a lot of pandemic-related consequences, such as closures of universities, loss of income, and those may really contribute to poor mental health. We're seeing a larger than average share of young adults reporting symptoms of anxiety and/or depressive disorder. And we know that compared to all adults, young adults are more likely to report substance use and suicidal thoughts. We know job loss has also been a really significant stressor, and many people have experienced job or income loss, which has really affected mental health. We're also paying attention to how children and parents, particularly mothers, are impacted. We know that women with children are more likely to report symptoms of anxiety and/or depressive disorder than men with children. Many mothers are experiencing challenges with school closures and lack of childcare. It's also important to build awareness about how the pandemic has disproportionately affected the health of communities of color. Non-Hispanic Black adults and Hispanic or Latino adults are more likely to report symptoms of anxiety and/or depressive disorder than non-Hispanic white adults. Historically, we know these communities have faced challenges accessing mental health care. And lastly, many essential workers continue to face a number of challenges, including greater risk of contracting the coronavirus than other workers. So compared to non-essential workers, essential workers, again, are more likely to report these symptoms. Both those newly experiencing mental health or substance use disorders and those already diagnosed before the pandemic may require treatment, but they could face additional barriers to accessing treatment because of the pandemic. So we know how much this pandemic has drastically changed our day-to-day lives. For many of us, these changes have included a host of new stressors. And under normal conditions, we might have the tools necessary to manage our stress, but in COVID times, it can feel harder to cope. If the symptoms listed here describe you, your employee, or someone else you care about, you or they may be experiencing some elevated stress due to the pandemic. You'll see here listed things like difficulty sleeping, fear and worry, changes in sleep and eating patterns, feelings of sadness and grief, that excessive irritability, of course, increased substance use, difficulty making decisions, and the worsening of underlying health conditions. We know that, in abnormal times, these reactions are kind of normal, right? We've had so much isolation, uncertainty, and ongoing threat of illness. So it's really reasonable to feel overwhelmed, exhausted, and experience some of these other stress reactions. You'll see on this graphic on the right from the National Institute of Health, the key is to determine how much the symptoms are interfering with daily life. Mild symptoms can usually be managed with intentional self-care strategies. When symptoms are more severe and last 2 weeks or more, it's important to seek out professional help. So as an employer, right, before we approach an employee, if we're noticing a challenge, we want to have a plan. If you have a human resources department, really consult with them first. As a boss, you really have to have a plan for the benefit of your company and the employee. You'll want to know what policies and resources you have available. We know mental health concerns are unlike other performance-related issues, and therefore the approach must be different. We have to be empathetic, remembering that for people suffering from a mental health issue, it's typically not their choice to feel this way. And if given the choice, their mental health issue would not impact their work life. So we never want to discriminate against someone with a mental illness, and we want to be sure to have any conversations in private, expressing concerns by asking employee if there's anything going on that's making work troublesome for them. It's essential to provide employees with space and freedom to express themselves and speak openly. We want to listen carefully and express our understanding back, recognizing that the feelings they're experiencing are real, not to discount them, even if we believe they may be symptoms of the illness. Always respect an individual's need for and right to privacy. A person with a mental illness, experiencing a mental illness, has the same right to be treated with dignity and respect as any other person. The next steps are really dependent on the meeting and conversation you have with your employee. As an employer, you really have to allow employees the opportunity to seek help if they're willing. And this is, again, a good opportunity to consult with HR and potentially with legal. And some of the ways that employees can seek help is through their health insurance coverage, employee assistance programs like the one I work for, paid time off, other benefits. Additional resources you might consider pointing employees toward include the National Alliance on Mental Illness Maine chapter. Again, that's NAMI. They have great resources for families as well. And the State of Maine Strengthen Me program, which is a new program that came about through the pandemic. Northern Light Health is a partner in this statewide program to support people in Maine who are experiencing stress reactions to the COVID-19 pandemic. And if you don't yet have an employee assistance program or want to inquire about additional EAP resources, feel free to reach out to us at Workforce EAP, and we'd be happy to talk through the range of services we offer employers. You know, before I wrap, I really want to return to this topic of stigma. It's really important to me and to others in our field. The workplace is often, it's one of the most important environments to discuss mental health and illness, yet it's really the last place we expect to hear about it. Employees are afraid of discussing it with coworkers and bosses. They don't want to lose their jobs, damage relationships, or risk future employers learning of illnesses and judging them. The stigma of mental illness keeps them silent. Employers have the opportunity to change this climate of fear regarding mental health in the workplace, and there's really a lot of motivation for them to step up. We know mental health conditions cost employers a lot of money and lost work days every year. By addressing mental health issues in the workplace and investing in mental health care for workers, employers can increase productivity and employee retention. So I'm going to conclude today with a little scenario or case study. I want you to imagine a woman who experiences depression. And in the evening, she has a telehealth session with her therapist who tells her that depression is nothing to be ashamed of. She's lucky enough to have family members and friends and a partner who really helps her in her fight against that stigma. They really accept her depression as a part of who she is and her experience in the world. Then she goes to work in the morning. Nobody talks about mental illness. It's as if it doesn't exist. On the rare occasions she does hear about it, the conversations are not positive. Her coworkers don't have enough education to be sensitive. They accuse people of using mental illness as an excuse to be lazy or receive special treatment. She wants to believe her therapist and loved ones when they say her mental illness isn't a weakness. It's really hard to, however, when no one at work is coming forward. None of the people she spends the majority of her time with are telling her there's nothing wrong with her, that depression is okay. When people want to view their mental health issues in a positive way, they need encouragement and acceptance in all parts of their life. Inconsistencies or an absence of positive rhetoric in one environment can make it harder to fight the stigma of mental illness. So now envision the ideal scenario where employers disclose their mental health issues to employees, give presentations on mental health, and encourage people to discuss mental health issues. Some of the most talented and potentially valuable employees in the world have a mental illness. If employers want to hire them before other companies do, a reputation for an accepting mental health condition can be really invaluable. Current employees are also more likely to stay with a company that addresses their mental health needs and creates an environment where they can openly discuss their illness and their treatment. It's a real retention tactic that more employers should try. Thank you.
So thank you, Yamaya. I always appreciate how you help expand my view of the world and be able to progressively see through other people's eyes even better. So thank you for that. Next up is Jacqueline Sear, who will talk about substance use, focusing on alcohol.
Thank you. Nicely done, Yama. That was beautifully delivered. I just wanted to take a moment to thank you for allowing us this opportunity to talk about alcohol, and hope we can continue to shine light on all substances of abuse. Anything that brings pleasure to the human mind or body can become a disorder or an addiction. Alcohol abuse and misuse, like any substance use disorder, does not discriminate, and the demographic is far-reaching. I had heard a provider once say, "For all you know, it could be Mr. Rogers. Don't assume." Now, that being said, there is a noted rise in alcohol use in the state of Maine. So alcohol, the traditional, socially acceptable, that everyone does it, addiction, is involved in 3/4 of all diagnosed substance use disorders. It's important to note that alcohol use disorder frequently doesn't stand alone. Anxiety and depression often go in hand. There are multiple long-term health consequences with far-reaching implications. Alcohol use is amongst the 3rd leading preventable cause of death in the United States. It is the most widely misused substance here in Maine, with significant rises in the youth, women, and greater than 65 population. According to the annual report from America's Health Rankings, we did a survey of excessive alcohol use across the nation. And as
Jackie, could you move closer to your microphone, please?
Yep. Is that better?
Thank you.
Okay.
Yep, that's better. Thank you.
According to the study, as you can see, Maine is ranking higher in all categories but one. So how does this impact the workplace? There are negative ramifications for increased alcohol use, especially since most binge drinkers, 79.3%, are full-time or part-time employees. So how does that impact the bottom line? Lateness, absenteeism, safety concerns. The food service and construction professions are amongst the highest rated alcohol and other substance use disorders. Bad behavior and poor discipline, not meeting deadlines, not being prepared. Adverse effects on the company image. So I saw so-and-so the other night, driving home, drinking a beer at the stoplight in your company van. The customer relations piece. I'm not so sure what's going on with Sue, but man, she's been super grouchy. She used to know what I wanted before I asked, and now it's like she doesn't even remember talking to me. And then resentment among team members, such as Tom is supposed to be the team lead. He's always the last here, the first to leave, the only one who seems to be getting breaks. We're doing more than we did and should be. So how does it present? And what do you do? It would be great if it was obvious, make things so much easier, but it's not. Many individuals are highly functioning, and this enables things to be overlooked, explained away, or enabled. We have lost some of the ability to see those telltale cues during this time of COVID and working remotely. It's become difficult to see a tremor if someone has one. You can't smell the alcohol or even note the ruddiness of skin depending on the lighting. Here we've identified some red flags that you need to look for with falling asleep at work, being tired all the time, frequent mistakes, disappearing. The disappearing piece that ties into the Zoom. If someone who previously had been on camera and active and engaging, and now all you see is their black screen all the time, that's a worry point. Being tardy or call outs, especially on a Monday, Friday pattern. So it's important to realize that many things look like substance use disorder that would also need to be addressed. But it is so important to not ignore a potential substance use issue in the workplace. The number one reported reason people don't reach out at work, aside from judgment, is that they can't lose the job. I want to be clear, I am not an HR expert nor an attorney. And depending on the size of your business, different resources are available. If you do not have an HR department, then seek out an employment attorney for assistance. If you do have suspicion, gently explore it. Do not accuse. And if you're the coworker, then it's important to be supportive, be an encourager, not an enabler. Don't punch the clock for someone so they don't get in trouble. Don't loan money or make excuses. And if you're the boss, notify HR and seek guidance. Don't go it alone. Depending on the size of your establishment, EAP may also be an option. So what do you do? The first and foremost thing is reaching out and talking with your HR or an employment attorney. Familiarize yourself with your company's benefit plans. Make it clear that it is a drug-free workplace with clear expectations and written policies. Have compassion and resources at the ready, help reduce stigma, educate on substance use impacts on health and productivity in teams, promote self-care and model it. Have alternative ways to celebrate wins and acknowledge the stressful days that don't include drinks. A good resource for information on almost anything regarding to substance use is the SAMHSA website. People need to know that they are not alone. Seek a family member, friend, colleague, or health professional. Do not be afraid to ask. Do not stick your head in the sand. If you are the one struggling with use of any kind, please use the resources available to you. Northern Light Acadia Hospital, if we can't help, we likely know who can. There are many wonderful community-based programs. It just depends on your service area. And especially during this time of COVID, there are so many virtual options. Thank you so much for letting me speak with you today on this very important topic. I appreciate your time and welcome questions.
Thanks, Jackie. And I like the availability of resources for, what can be an overwhelming situation to deal with. So thank you. So now let's focus on questions. I will group similar questions together so we can address as many questions as possible. I'll start off with a comment made in our chat room. Interesting how some folks don't want to take their chances with the vaccine, but are willing to risk issues with COVID itself. And I think that's a really fascinating observation. Why are people so worried about the vaccine and not so worried about the COVID virus? A good question. So I think it really is about being able to have people understand enough information to assess the relative risk. And I deal with this in my own family, quite honestly, as probably many of you do. This sort of sense of well, vaccines can do this, they can do that. They hear things like, well, having a major vaccine side effect is similar to being struck by lightning. I don't know that resonates so well with people, but the way I try to describe it, and I've done this many times over the last couple of months, I describe it, I don't know if you could see me very well from there, so I'll do it this way. The vaccine risk is about that big. And that's because while science knows a great deal about the COVID vaccines, it also knows a great deal about vaccinations in general and how they're very similar in lots of ways. So they can actually understand and figure out the risk as being about this big. The COVID-19 not only is causing the mild disease, the ICU, the ventilators, the deaths, but as Dr. Jarvis shared with us, there's these ongoing long COVID symptoms that we don't really have a handle on. So when I describe all of that, the risk grows and grows and grows and grows. So the risk of the COVID virus is this big, and the risk of the vaccine is this big. So, my bottom line is, from a scientific point of view, it really is a no-brainer. So thanks for that observation. I appreciate that very much. Dr. Jarvis, the first question here is for you. Are the symptoms you talked about for long COVID found mostly in people who had severe symptoms acutely?
Yeah, that's a great question, Ed. So we know that people who've had severe symptoms certainly have more long-term sequelae, but anybody who has been symptomatic from their infection with COVID can experience long-term neurologic deficits, particularly that brain fog. And when you talk to those individuals, they may not even be aware of the fact that they're having difficulty with concentration or even some memory issues. But sometimes they'll describe, well, you know what, I just don't feel right. And then when you talk to their family or coworkers, it's their family or coworkers who said, I've noticed a change in their ability to communicate. They often have to search for words more often. And sometimes they frankly just look lost at work and then kind of catch up as the moments go on. And so it could be that person who was always so attentive at your meetings and now seems to always be, daydreaming. That might be a telltale sign that they've had some neurologic deficits. Now, of course, we know that people with severe COVID can have really long-term effects, particularly if it affected their heart or lungs during their illness period. But I think what we're going to find is that many people who had these mild symptoms actually have some long-term deficits. When we talk about long COVID, that's a lot of different symptoms that fit under that particular caveat. And we know that those individuals have had symptoms now for months and some people for over a year. I spoke to somebody yesterday where we have a mutual friend who is frankly a genius, has their doctorate, travels around the world, gives lectures everywhere. And they had COVID about in March of last year, so over a year ago. They were very sick, but because they were fortunate to have great healthcare, we were actually able to take care of at home rather than being in a hospital. And a year later, that person still has trouble carrying on a normal conversation. And this is somebody with probably a genius IQ. Words to think about.
Wow. You know, Dr. Jarvis, I'm going to stick with this theme. We have a question here about long haulers. What theories exist as to how in COVID long haulers, the virus jumps from a respiratory condition to a neurologic condition? And, you know, I'll follow up with my own question. Talk a little bit about the other organ systems that are affected by long haulers.
Yeah, those are great questions. So first and foremost, typically we talk about coronavirus as being a purely respiratory and typically an upper respiratory infection. It typically causes colds. This particular coronavirus, however, affects our lungs as well in our respiratory system, and for some reason has affected other organs as well. Some of that is due to the immune response that the virus causes, not the immune response the vaccine causes, turning our body against itself. And that's what we think is probably the cause of the blood clot syndrome that we see with people who get COVID-19. And then that, of course, can cause serious effects on cardiovascular, meaning that it can cause you to have a heart attack and other damage to your heart, and stroke. And so that's damage to your brain. But we've seen that this particular virus can affect just about any organ system, including our liver, our kidneys, and we're seeing people who have long-term damage. Most people with long-term effects from COVID, it's usually damage to the lungs though. And we have great evidence because we can do what we call pulmonary function tests or see how well our lungs are functioning on individuals who have had COVID and continue to have COVID symptoms, and many of them have decreased lung function. Again, it's primarily a respiratory virus, and so that's expected. But really, it can affect just about every organ system. Better to be vaccinated than to get that long haul syndrome.
Yeah, so I'll build on that a little bit, Jim. I mean, I think this is really a fascinating part scientifically. While it's transmitted through the respiratory system, and you know that the symptoms that we have particularly in the acute phase, are very much related to the infection in the respiratory system, it does seem to affect small blood vessels, the clotting system. So we can see, not infrequently, people ending up with strokes due to blood clots, or even due to inflammation in the very smallest of blood vessels. And then when we start thinking about all these other organ systems that are affected, it's very likely to be related to the effect on the small blood vessels, which are pretty much everywhere. So I think a lot of the symptoms that we see, it depends on what organ systems are particularly affected, what parts of the organ system, in the case of the brain, which part of the brain, and that will influence the kind of symptoms. So this is a very, very complicated story that sometimes seems very easy when it's like, well, I only had mild symptoms. There may be more to that story. So thanks, Jim. I have a comment here from our audience. If time, can you talk more about vaccination in kids? When do we expect vaccinations for kids under 12? So great lead in. I probably should have used this at the end. It segues into our next session, June 3rd, which is devoted to answering those questions specifically. So I'll hold off until then and not go down that pathway for now. With the new mask standards coming out for vaccinated individuals, how do we in the workplace know who has or hasn't been vaccinated? If we ask an employee, we are going against HIPAA or OSHA, the question. Jim, you're probably in the best position, recognizing that you're neither an attorney, not that I remember anyway, or an HR expert. So with that qualifier, I think I can answer the first one. It's really built upon an honor system. So are you not vaccinated? But take it from there.
Yeah, and I think it really depends on the particular type of business that you are. So certainly here in healthcare, we are privy to certain aspects of people's medical records because it's a different kind of public safety issue than it is at some other businesses. And so really, this is one where you're going to have to really, speak with your labor attorney and get get the particular information. We also know that things are different from state to state on what can and cannot be asked, as well as whether or not you in a particular industry can mandate either masking or vaccination. There are different rules for public and private sector, so it's actually very complex. And frankly, it seems to get murkier as the days go on, as we start to see local and state governments doing different rules than the federal government. So really, it is time for you to check with experts.
Yeah. I think we all have to be careful. While we're all so willing to help people, we have to be sensitive to privacy as well. Another comment here in the chat room: there are professional athletes that now have to use inhalers, and we're back to the long haulers issue again. This is much more significant than collectively I think we appreciate. For those of you who are interested in learning more, you can search online to look at what a number of hospital systems are doing across the country. The one that comes to mind where I started first learning about stuff like this is Mount Sinai in New York. They actually have a post-COVID clinic that has thousands and thousands of patients there, and you can learn an awful lot about what they're reporting. Some of the examples that I've seen is young people who are marathon runners, literally marathon runners doing several marathons per year, now in a position after only mildly symptomatic disease, have the toughest of times maintaining their balance and walking. So that's a far cry than their pre-morbid condition where they were able to do marathons. So unfortunately, there's lots of stories like that. So here's another comment in a series of questions. Well, actually, no. If I am fully vaccinated, can I still contract the virus and have mild symptoms and end up with the long hauler symptoms, such as permanent loss of taste and smell? Have there been any studies on the fully vaccinated? Well, I'll take a shot at that, and then Jim, I'll look to you to weigh in as well. I think if you're fully vaccinated, you can get the virus. I think we recognize that that is the case. It's much less likely to cause any kind of severe disease if you're vaccinated. Your viral load tends to be quite low, and it's thought that your ability to transmit the virus to others decreases by somewhere around 90%. So, really lowers the risk tremendously. It does not get to zero. You may recall in the beginning they were talking about efficacy or how much it protects, the vaccines protect, and we were talking about 95%, 94%, others in the 70s, depending on which study you look and which vaccine. But overall, these vaccines do a great job of keeping people from needing hospitalization and dying. That's what by design they do, and they do it really well. But it doesn't prevent you completely from getting the virus. The long hauler symptoms part, Jim, I haven't read anything about that, and I haven't seen any studies. I don't know if you've been exposed to any of that, pun intended.
And I think it's just too early to tell, right? We've only been vaccinating the general population since January, with large numbers really being in February, April, and May. And so I think it's too early to tell, but I will say that the absolute risk, and this is where absolute and relative risk play a big role, the absolute risk of developing long haul syndrome is much less in the vaccinated population because it is much less likely that they would get infected anyway. We imagine, though, that if somebody was to get infected post-vaccination, because not only are their symptoms milder, but their immune response to the virus would also be milder because your immune response that the vaccine enhances would limit the amount of virus that actually gets reproduced inside your body. So it would probably decrease your relative risk, meaning the risk once you get the virus of having long haul. Too early to tell, but that's probably what we're going to see.
Yeah, and Mary, that's very much on our radar screen going forward. So we'll be very tuned into trying to learn about this and share that kind of information. I'll share a personal experience here recently. I've been fully vaccinated for a couple months now, and I took the opportunity to fly to Florida, and it was interesting. I observed in the course of a week probably an easy 1,000 opportunities to get the COVID virus. And the Florida approach to it is really quite a bit different than Maine. I mean, we're still much stricter here. And there were times, even though vaccinated, my wife and I were the ones with the masks and a lot of young people without the mask. So you could see how the numbers are still spreading across the country. And interestingly, further, upon returning home several days later, I got a call from the Maine CDC to tell me that where my seat was on the plane, I was in close contact with someone who was COVID positive. So it turns out that luckily I had no symptoms. I had no need to be tested. The vaccine apparently protected me quite well. So right before your eyes. Next question is for you, Maya. Are we seeing the increase in anxiety and mood disorders diagnoses as situational because of the pandemic, or is the pandemic revealing the underlying problems, or perhaps both?
Great question, and I would say both. I think, you know, I believe many people live with symptoms of anxiety or mood disorders that they have found ways to manage through self-care and through through just really the support of their support system. And we know that so many of those supports and that ability to care for oneself through daily routine and exercise and all that people do to maintain their well-being was really taxed with the additional stressors of the pandemic and the the physical distancing and social isolation that people were called to do for health reasons has had a big impact on mental health. So those very kind of self-care habits that maybe allowed many people to manage their symptoms well were not as accessible, and therefore the symptoms became less manageable, and people were therefore screening more and reaching out more for professional help. So I do think that there's a big part of it that is that. And I also think for many other people who didn't have underlying conditions or symptoms before, this pandemic has really rocked many people's worlds. It's been very challenging and thrown a whole lot of new stressors into their daily lives that has really made them maybe for the very first time experience symptoms of anxiety and mood disorders. So I do think it's both. And that we just really need to, like I continue to come back to, keep these conversations going and open, and so that we can really help address challenges before they become really big problems for people and greatly impact their ability to function.
Thank you, Yumaya. Yeah, it is pretty complex, and it sort of seems like a lot of overlap between the stressors of the pandemic and what people's underlying conditions are, and what their resiliency is, quite frankly. Yumaya, I have another question for you here. Considering the large number of people who have mental health conditions, some diagnosed, some not, and the impact COVID is having on everyone, should an employer look to react when people are having problems, or to educate the whole team and try to get ahead of the issues? So I think it's kind of something along the lines of reactive, proactive, huh?
Well, again, I'm going to say both, right? But I think that most often our best public health, whether that be physical health or mental health, our best approach is always preventative, right? And the more that we can do upfront to create a culture in which we're educating about all areas of health and wellness, including mental health, and creating a safe environment where people can talk about their challenges and reach out and get support, that's where we're going to have the greatest impact. Now, granted, we're also living in a bit of a crisis situation where we're having to be more reactive than usual. So I would say we also need to be responsive. And I like that word responsive instead of reactive, because for me, reactive connotates like having kind of an emotional knee-jerk reaction. And I think we need to be really thoughtful in the way that we respond when we see employees who are really struggling, and approach those individuals with a lot of respect and thoughtfulness, and do the work up front to figure out how we can really most effectively support them.
Thanks, Yamaya. I have another follow-up question for you. Do you have any good resources for seeking help for mental health for the uninsured?
Yeah, so I would say in the state of Maine, one of our greatest resources is 211, right? So that is, you can pick up the phone and just dial 211 if you're in the state of Maine, or you can look on the website 211. And there's a host of resources that ranges from mental health for the uninsured to, I'm sure Jacqueline often references it, with patients that are seeking help for substance use. There's also things like housing support and a whole bunch. It's our kind of clearinghouse in the state for all sorts of resources, and you can sort by what you're looking for. So that would be the primary place I would start.
Thank you, Maya. I have a comment here from one of our audience members sharing a personal story. She has a professional friend who's trained at a PhD level, who had a mild case of COVID-19 in April of 2020 and still has long hauler symptoms of brain fog, loss of taste and smell, which is, you know, when you think about that, we're up to going on 14 months for that individual. So, oh boy, that's kind of like a scary scenario. Like, does it end? When does it end? So I think long haulers is something I think progressively we're all going to be talking about a whole lot more coming soon. So hopefully that translates for all of us on the call today to encourage vaccination for everyone. Okay, let's see. Jackie, the next one's for you. Do you expect the alcohol use to return to pre-COVID times once people are no longer locked down and isolated?
Short answer, no.
I think that is an interesting problem.
Yes, I think that, you know, alcoholism and overuse was a huge issue before COVID. And then during COVID, there was an elevation for people who had difficulties with it to begin with. There are people who are currently battling it. And then we're having restrictions being dropped, and celebratory things are going to start happening, and it's summertime and gatherings and stuff like that, where use of alcohol is more frequent. So, and our stressors are going to change, right? We've never been post-COVID before. So now we're going to have to figure out how to navigate that as well. And many people drink to deal with stress and soothe the mental health things that go with that. And it's just that vicious cycle. So I think there's more to come.
Yeah, I suspect you're right. The new normal may include that as well, huh? Jackie, I have another question for you. Many of the impacts you describe seem to overlap with mental health issues. They seem like clues to the underlying problems. How can I figure out whether someone has an alcohol or substance use problem, or a mood or anxiety disorder?
So in this arena that we're talking about within the business world, really it's important first and foremost to identify that there's something going on and reaching out to your resources. But it's important to have the professionals within that field drill down in and figure out what that underlying thing is, because you know, it could be a situational stressor that they're just responding to, and not necessarily a full-on mental health issues. So I think that the most important thing that can happen is first identifying that there's a problem, and then reaching out to experts for help.
Mm-hmm. Yeah, so getting that expertise in pretty quickly, huh?
Yes.
Yeah, but being aware and looking for, you know, people who are having problems.
Absolutely.
Yeah. Okay. Great. Jackie, I have another one for you. How often do people have use problems with alcohol and another substance at the same time. So I guess co-use question.
Yeah. Co-use is actually very common. And as I had spoke earlier, 3/4 of all of the substance use diagnoses include alcohol in there. And so the substances could be very broad, so it's hard to kind of drill that down other than knowing it is extremely common.
And there's overlap in, the use patterns, et cetera. So Jackie, I'll make a comment for our audience. Like, while we chose to focus on alcohol because it is the dominant substance use problem in Maine, that doesn't diminish the opiates that are out there and how opioid use really is very consequential. So we certainly could talk about that for another day, but I don't want to look like we're discounting it because it is an equally important topic.
Absolutely. And thank you for that, Dr. Gilkey, because I think that, as I said in the beginning, anything that causes negative consequences, but does bring pleasure to the human mind and body can become an addiction and cause detriment within one's life. So it's super important that we recognize there are so many substances of abuse and we need to pay attention to that.
Yeah, thank you, Jackie. Maya, I have something that I think may interest a lot of other people here. Are there structured educational programs that an employer can bring into the workplace? If yes, what kind of costs are associated with that type of education?
Well, thanks, Dr. Gilkey, for giving me the opportunity to talk about that, because it is really important to know what resources are out there and to recognize that as employers, it's not expected that you would have all of them internally within your own organization. So really relying on those experts. There are great programs through organizations like NAMI that will come in and do some education. That's the National Alliance on Mental Illness. And then that's if you're looking specifically for education on mental illness. And then there's organizations like ours, Northern Light Workforce, where we come in and offer trainings, and we can do different clinical support groups. And a number of our trainings help with things like how to build resiliency or stress management. And again, it's a lot of those kind of proactive, preventative kind of techniques to help people and avoid potentially some of the burnout or negative consequences that we can see in the workplace that can contribute to mental health issues and to substance use. Costs associated, really depends on the service, and I would just encourage people to reach out if they have more questions. And our contact information is available on the resource page through the business to business website. So
yeah,
and really,
excellent.
if you have any questions, get in touch.
Yeah, great. And we certainly welcome that. Thank you. This is going to be the last question, and Jim, we only have probably a minute to answer it. So, and this comes out of a playbook that I probably could directly ask myself, since I'm dealing with this with one of my kids. So a young person could have mild COVID symptoms and then have these other problems occur later, and they could last a long time.
Yeah, that's exactly right. And I think that's the lessons that we're learning the longer that we see individuals who have been exposed and contracted COVID-19. That this virus is not something that is the usual thing that we talk about. This is not the flu. This is not the common cold. This is a serious condition that can have long-term consequences. And as one of the people commented in the chat, we're seeing professional athletes who are needing to have, some kind of assistance to do their job, which is to get out there and do their sport at a high level activity. For those of us who are at best weekend warriors, any decrease in our overall capacity can hinder that. And so, it's a word to the wise. This is definitely something that affects the young and old alike. It crosses all spectrum of race, creed, color, political avenues, religion. It doesn't care. It only cares about infecting and continuing to infect and harming and continuing to harm. Vaccination is our way out of this. And so if you're eligible, please sign up and get vaccinated.
Thanks, Jim.
And
And-
support your staff to do the same thing.
Perfect, perfect. Well, as you can see, our hour has evaporated on us. We've included some tools for you at the end of this presentation. Thank you all for joining us, and thank you to our speakers. I hope this hour has been a help to support you, your employees, and our communities to safely manage your business. Just a reminder, we will be emailing you a survey right after our conference. Please be sure to give us your feedback so we can continue to provide relevant information. Our next session, which I whet your appetite earlier on, will be on June 3rd. Our theme is vaccines, hesitancy, and children. This will be very informative, not to be missed. We will send you the link for this session. We encourage you to share the invitation with your friends, colleagues, and others who might benefit from this information. By working together, we will keep Maine safe. Thank you and have a good afternoon.